inspiring talk. He's none other than Professor Dr. Chintamani. He's the head of surgery and surgical oncology, Safdarjung Hospital and Vardhman Mahavir Medical College, New Delhi, India. Welcome again, Professor. Good to have you here again. So we are so glad, sir. Welcome again to the conference. Again, another interesting and breathtaking talk that you had. I'm always mesmerized by your talk. Lots of good quotes. So how do you find the conference so far, and what's the difference between the previous one and the current one?
Well, first of all, thank you very much for having me. It's such a joy to be here. So much of energy, so much of positivity, and sitting next to Swamiji and listening to him, getting his blessings, and also from Acharya Shri. So it makes it a very special moment. Coming to the personal joy, I mean, it's tremendous. I was very tired, but I made the point to come at least for a day. I would have loved to stay here for 3 days. The conference is very enlightening actually. Since morning, we've been listening to some brilliant speakers on the actual concept and getting down to the brass tacks. From plants, how does it translate into clinical use? I hope it'll grow that way, and personally I learned a lot from others in the sense that you have so much to do, and you're sitting on a gold mine. The story of a beggar who spent all his life begging, and when he died, people were digging under him and they found treasure. So many times we remain beggars without knowing that we are sitting on such a treasure. It's got to do with the lack of awareness, which in true sense is the ignorance of the present day and the present mind. So if we get over that, and if we are aware of what's around us, Indian medicine can always live in its glorious times again.
Very, very good advice. So now, ethnopharmacology, ethnomedicine is about bringing the old traditional medicines, and we have modern science to support it. So what do you foresee? What's your forecast of the future of ethnomedicines in the next 5 years, or maybe in the next 10 years' time?
Oh, I'll answer both 5 years and 10 years.
Yeah.
Because the immediate next 5 years, so I'll be very honest with you, as far as the modern medicine is concerned, everything is modern, the way we look at it. Surgery has grown, but we are learning to do less and less surgery to conserve organs. But for some reason, the medicines have become more and more aggressive. So, considering the benefits you get out of medicines, but importantly the damage that it causes to the normal cells or the normal body, I think we have no choice but to move towards this concept. Now, the faster we do, better for us. The good news is, in today's scenario, things don't take that long to change.
Yes.
That's why I said immediate 5 years would be something like a change in the mindset.
Yes.
And in 10 years, I see it happening.
Yeah, that's good. So, and PRI, our mission is to bridging, marrying the two traditional and modern medicines together. So again, what would you give the advice to the scientists, especially the chemists, as they produce all this
Brilliant question, and you put it very nicely. That although we are trying hard to bring the two together, you know one thing, I mean, if you really analyze it, they're always together. It's just that we're looking at them differently. It's like you're looking at a couple differently. You're only looking at one side of it. So we probably have started having a better look at it now. And coming to the second part of your question, which is even more interesting. If I am sitting in a lab and I'm working on a petri dish and I'm at the microscope, I shouldn't forget that this tissue or this concept or this whole idea has got to do with human beings. Even if you're doing an experiment on rats, which I'm not a great fan of, but suppose one is doing it, it is with the human being in mind. So important thing is for a scientist today, especially the basic scientists, everyone is a scientist. Basic scientists should not work in isolation, he should have a clinical message. So the research questions need to be rewritten now. Unlike in the past where the research question would be about something very complicated. Excuse me. In any marriage, as you mentioned, the usual cause of failure is lack of communication. And if you consider this the same thing, as you mentioned, you stealing out of what you spoke, they need to understand that it is not about somebody sitting in some corner, coming out with a very small molecule to claim a Nobel Prize. It has to make a difference in the human beings' lives. So if you're creating, if you're doing a research, the research question should incorporate the clinical side of it, which is usually missing. And the vice versa is also true. You just do the clinical side of it without having to look at the basic aspect of it. So they need to be together, and more projects and more research questions should be framed with the basic science and the implication, the clinical implication, which is the theme actually, from plant to patients.
Yes.
So you just can't be working on plants, and I can't just be working on patients and meet someday. No, we should be working together, and both the plants and human beings become a part of our research.
Very, very good advice, very motivating and inspiring for the scientists at Patanjali Research Institute. So just one last question for you, sir. Give us one line about Patanjali Research Institute.
Godly.
Oh, thank you so much. Oh, with so much gratitude for
Godly
you.
and divine.
Oh,
And inspiring. We wanted more words. Really full of energy, dynamic, happening, living, and spreading the joy. So joyful, living, kicking, and inspiring, godly, divine place.
thank you, sir. Thank you for coming again, and we hope to see you in the next series as well.